Okay, healthy foods are good for you, right? Vitamins are good for you, right? Except there's some very, very kind of difficult to take research. And I'd like to talk a little bit about that because it has some implications for how you eat and what you eat, what your diet should be, and how you should think about vitamins. So I would like to tell you that lung cancer is a big problem, right? Smokers get lung cancer. And lots of research decades ago showed that if you ate a healthy diet that included foods with high levels of vitamin A and vitamin C, the smokers who ate like that had lower risk of getting lung cancer. So that was exciting. And then they measured blood levels in the blood of vitamin C and vitamin A and vitamin E, and they said, boy, the patients who smoke cigarettes, who have high levels of vitamin A and C and E in their blood, have a lower risk of lung cancer. So the Veterans Administration has lots of old smokers. The Veterans Administration is seeing all these ex-GIs who are getting lung cancer, and that costs them a fortune. So they came up with a, I think, obvious suggestion. Why don't we just take thousands of our veterans, split them up into a good study, and give some vitamin A and some vitamin C and vitamin E, and show once and for all scientifically that we can help decrease lung cancer in our veterans. Because we have all this good research showing how much it helps. So they did that study, and they had to stop it early because the vitamin A and vitamin E people were not getting less lung cancer. In other words, they had some veterans who got sugar pills, placebos, some who got the vitamin A and vitamin E and vitamin C in different mixes, and the ones who got the vitamins did not have less lung cancer. In fact, there were some parts of the study that suggested they might even get more. Another part of the study, maybe they had more hip fractures. How can that be? All right, put that one aside. A bunch of studies like that. Recently, you might have seen in USA Today or the newspapers a study about prostate cancer. Okay, prostate cancer, big problem for men. Okay, big problem for men. And lots of research, again, showed that men who had high levels of zinc, vitamin E, and selenium in their bloodstream had lower rates of prostate cancer. And people who ate healthy foods that had selenium and zinc and vitamin E had lower rates of prostate cancer. So they got 7,000 people together. They started feeding them either the sugar pill or selenium or vitamin E or zinc or a combination, and they planned to study them for 8 years, and they stopped it at 5 years, and big front page news, the ones taking the vitamins were getting more prostate cancer. Okay, so how can this be?
I would think it's based on getting those nutrients by your way of your diet, actually.
Right, so maybe it's not the vitamin themselves, but they're a flag. They're saying eating a healthy diet is different than taking a vitamin. Okay.
She forgot to take a pill this morning, so she's
Okay, we'll talk about it in a second. Let me finish. Okay, so what they're saying is, and what we think now is, eating a healthy diet that has lots of vitamins and minerals in it is not the same as taking a pill. What would we like as busy Americans? What would we like? We'd like to be able to run out the door in the morning, eat a Twinkie on the way to work, and pop a vitamin tablet and be healthy and protected. Do we actually want to sit down and have a healthy grapefruit and cut up the grapefruit and eat that with a banana or something like that, slowly and cautiously with a good healthy breakfast? Do we want to pay extra for organic, healthy, green foods? Or wouldn't we like something in a package that's plastic that we can keep in our pocket, as opposed to, you can't carry around a head of lettuce? So ideally, the research should have shown, what we wish it would have shown is we can eat whatever we want, taste whatever we want, and then add a vitamin tablet and get the benefits. And lots of research suggests that the tablet does not equal the healthy food that carries that vitamin. So what are our foundational principles is what we recommend for our patients after surgery. And even for those of you who are not having surgery, what are the recommendations? And it's really simple. Kind of eat a healthy diet. Okay? Do we recommend like an Atkins diet of bacon and high fat or something like that? No. What we recommend is eat a healthy diet, and that's fresh fruits and vegetables, which happen to contain vitamin A and E and C and things like that. And we think that's very healthy, and trying to get that benefit through a tablet in very large studies has failed. So what we recommend, although it's inconvenient, healthy diet. And surprisingly, this research has kind of tripped up lots of us, and our government and scientific research organizations have spent a fortune trying to show that a tablet would equal a fresh green salad. And as far as we know, Okay.